The aim of this study is to understand violence and their rights. Also to develop the solution in the partnership with many stakeholders. Study was found in after the Pattaya consultation in 2010. We have discussed about the violence against sex workers. So, and then APNSW have selected the country where they have the member organization are strong and who are willing to participate in this study and facing the challenge of the sex worker to become the part of the advocacy. This study was conducted in 4 countries. Nepal is GMMS and Blue Diamond. Indonesia is the OPSI, and Sri Lanka is the CSDF, and Myanmar is the AMA and SWIM.
The study conducted by sex worker community in Sri Lanka, Nepal, Myanmar and Indonesia. Sex workers from our organization trained to become a community research. Collecting data and peer review has been done to identify the findings. Through this research, we understand violence and sex worker and relate it to HIV. And this research will help us to call the government to create enabling environment so that the right of sex worker can be protected and upheld.
සොයාගත් දේවල් තමයි සෑම කෙනෙකුම
All respondents in these interviews reported that they experienced violence from family, society and police in the form of physical, mental, economic violence. In addition, the sex workers belongs to a high-risk group to HIV. In police custody, they face a high risk of HIV due to rape or gang rape. In Sri Lanka, we have old legal system and laws like Section 365 and 365A, which needs to be reviewed to reduce violence against sex workers. It is necessary to increase capacities of junior police officers who do not know about sex workers on the street.
I would like the sex work to be regarded as one of the works. Sex workers will be able to get access to health and other services once stigma and reduction is reduced. There is a need of organizations such as UN, government, INGO, NGO, sex worker community that practice non-discrimination over sex workers to collaborate. Laws to protect sex workers from abuse and violation. To eliminate discrimination over male, female, transgender in our environment.
When sex workers are sent to jail, their rights must be protected. Free legal aid is not available to sex workers. When sex workers seek medical services, they are not given attention and society stigmatizes them. Organizations such as police, health, NGOs must coordinate with sex workers. NGOs alone cannot implement these services for sex workers.
In Nepal, sex workers are criminalized, and like other citizens, they are not able to exercise basic human rights. It's very important that the sex workers are provided the rights, and it's very important to change the attitude of the society so that the violence against sex workers can be minimized to an extent.
Looking at the research result, we know that life as sex worker is not easy. We need courage, fortitude, and support from the government and other stakeholders to be able for us to survive along with our family. If the government want HIV response be success, the involvement of sex workers since in the beginning, from designing, implementing, until monitoring evaluation is a must. Nothing about us without us.